My name is Danilee Pudwill. I work at the Monument Health Hospital and Outpatient Clinic here in Spearfish, and I am a speech-language pathologist. Now, most of you are probably wondering what that is. Layman's term, we are a speech therapist. The education required to become a speech-language pathologist is you obtain a bachelor's degree in typically communication sciences and disorders, which is a 4-year program. And then you will apply for a graduate school to receive a master's degree in specializing in speech-language pathology. So a total of 6 years. So I kind of have a funny story. In high school, my high school choir director actually was a pretty significant stutterer. And it kind of pushed me to be interested in more of a medical field in helping people be able to communicate better. However, I really didn't know about speech therapy at that time. So I went to college, decided I would just do my generals, you know, the math, the sciences, the histories, all the basics that you have to take anyway. And my mother called me one time on the phone and said, I just saw something on the news and I think it would be perfect for you. And I was annoyed, of course, because I didn't need my mother telling me what I should be doing for my lifetime job. But she was right. I searched speech-language pathology and it was definitely the fit I was looking for because I did want to do something medical. And this was an option for me. So I pursued it and here I am. So speech-language pathology is in several different areas. So of course, like me, you can be in a medical setting. You can be in an inpatient, meaning hospital, or outpatient, more clinic-based. There are speech-language pathologists in the school districts working with children of all different ages. There's nursing homes, and there's, actually research centers too that are always looking for people more interested in researching all different, disorders and challenges with communication. So there's a wide range of where you can work. You have to think on your toes a lot. All of us, we go to school, you learn the textbook information, and you think that when patients are going to come here and say, for example, they've had a stroke, you think all stroke patients are going to be the same and they're going to be treated the same. And that's by far not how you should approach a patient, because they are all different and the challenges that they're having are all different as well. So I would say that's the biggest thing I've learned, is you have to have an open book, because what you expect is not going to be what truly is the case. I love my job for several different reasons. In my particular setting, I'm the only speech-language pathologist working here in Spearfish, so I work with a wide range of patients. I have worked with infants with feeding problems, all the way up to kind of end of life. But I like the wide variety, and it kind of keeps me on my toes. I don't just learn one thing. I have to kind of know a lot about each discipline or area. I think one of the most important things about speech therapy is, yes, the math, the sciences, physics, anatomy, they are all extremely important, obviously, because that's the medical field we're in and you have to, receive good grades in those. But I really think having good social skills and having kind of like a psychology background is also important. We are working with patients who they've had a change of their life. If they've had a stroke or a traumatic brain injury or something, it has really impacted their life. And a lot of times they come here and find comfort in being able to talk to me about things that are bothering them. And so you have to have that side of you too, to have compassion and understanding and guidance for them, to help them through this. So I guess something that's unique about speech therapy, and that I always like to tell people, is a lot of times when people hear speech therapy, they think, oh, you help people talk better. Yes, we do, but a whole other side of speech therapy that we treat. We treat voice disorders, we treat swallowing disorders. So those are, and cognitive disorders. So that's like your memory, your problem solving, your foresight and planning. And a lot of times when I tell people that I treat those areas, they can't believe it. So that's kind of a unique thing about speech therapy is we do not just help people talk better. So relevant job experiences, if you're kind of wanting to go more the route of working with children, more in a school setting, good job options would be daycare settings, tutoring children. You just start to learn how to be around children, how to ask them questions, how to engage them, what things interest them, and how to develop a relationship, because without relationships, children aren't going to trust you in order to, come see you however many times they're going to come see you and be willing to work with you to get better. I would say I've lucked out. I've only had to have one job interview, and it was with the job for Monument Health. But I truly went in there being myself. Yes, when they ask you questions, they want to see how much knowledge you have. That's one thing. They're looking for upbeat people who are striving to want to, create new programs and have that motivation to do different things. And so honestly, I know it's kind of silly to say just be yourself, but ultimately it really is, because if you go into a job interview not being yourself, it's probably not going to work out really well for you.